Is a combined COVID and flu vaccine safe and protective? What treatments are best for mixed urinary incontinence in women? All this and much more on this episode of the JAMA Editor's Summary. Hello and welcome to our listeners around the world. Today is Friday, May 9th, 2025. I'm JAMA Deputy Editor Dr. Preeti Malani, sitting in for Dr. Kirsten Bibbins-Domingo, the Editor-in-Chief for JAMA and the JAMA Network. Today I'm joined by JAMA Senior Editor Dr. Ann Cappola. Hi Ann, let's get started.
Hi Preeti, let's do it. You first asked about a combined COVID and flu vaccine. Well, let's start with the Phase 3 randomized trial by Dr. Spergel and colleagues, in which they investigated humoral immune responses and safety of mRNA-1083, a combined influenza and COVID-19 vaccine in adults. They report the combined vaccine met non-inferiority criteria and safely produced higher immune responses than standard influenza and COVID-19 vaccines.
JAMA also published a randomized trial comparing two treatments for mixed urinary incontinence, which includes symptoms of both stress and urge incontinence, in adult women whose symptoms persisted after first-line therapy. Dr. Harvey and colleagues from the National Institutes of Health-funded Pelvic Floor Disorders Network randomly assigned participants to either intradetrusor injection of OnabotulinumtoxinA, or Botox A, or surgical synthetic mesh Midurethral Sling. The investigators observed no overall difference between the treatments, with both interventions improving symptoms at 6 months.
In their accompanying editorial, Dr. Roberts and colleagues emphasized the importance of this rigorous evidence for treatment of mixed urinary incontinence.
And JAMA published a research letter this week about the Medicare Advantage Quality Bonus Program, in which Mahir Dixit and colleagues explored budgetary implications of quality bonus program reform using Medicare data. They estimate that while reforms could save roughly $2 to $14 billion in 2026, reform impact varies with contract characteristics like quality and geographic location.
That's a pretty significant impact. JAMA also has a research letter by Dr. Tumalapalli and colleagues that discusses penalties for dialysis centers that serve populations with social risk factors. The authors assess the effect of implementing stratified benchmarks for dialysis facilities based on the proportion of patients dually eligible for Medicare and Medicaid or low-income subsidy recipients. They conclude that while financial penalties increased over time, this increase was not observed for facilities serving higher proportions of low-income or Black patients.
Michael Liu and colleagues contributed a letter about recent research grant terminations at the NIH. They report that more than $1.8 billion in NIH grant funding was terminated, and that these terminations affect nearly all NIH institutes, especially the National Institute on Minority Health and Health Disparities. They include interesting data tables and also note that 20% of these terminated awards were classified as training, fellowship, or career development awards. JAMA also published a viewpoint this week from the JAMA Integrating Clinical Trials and Practice series. Drs. Dreyfus and Masika Zaitoun discuss current considerations for managing tricuspid regurgitation and advocate for more randomized trials with concrete clinical endpoints to better compare available treatment strategies.
The JAMA review focuses on an important women's health topic, endometriosis. Dr. Asani and colleagues describe the presentation, management, and contemporary treatment of this troubling condition. Dr. Asani discusses how clinicians should approach diagnosis of endometriosis with JAMA Senior Editor Dr. Karen Lasser in this week's JAMA Clinical Reviews podcast.
Endometriosis, most commonly, the earliest symptoms often present in adolescents or in young women. And so it's often primary care physicians and even pediatricians that are the first providers that encounter patients with symptoms of endometriosis. What I would say is really the biggest alert is Ask patients about their periods. Are your periods painful? And if somebody's periods are painful enough that it is interfering with their activities, their ability to go to school, their ability to work, their ability to engage and socialize with friends, endometriosis should be on the top of the differential diagnosis.
JAMA also published a clinical guidelines synopsis about intravenous albumin, authored by Dr. Fust and colleagues. They reviewed recommendations from the International Collaboration for Transfusion Medicine Guidelines.
And with travel season ramping up, be sure to check out this week's patient page on typhoid fever, including symptoms of infection and recommendations on preventing illness for patients traveling to endemic areas. Search for JAMA Medical News or click the link in the show notes to find the latest articles in clinical medicine, biomedical research, public health, and health policy written and researched by our outstanding JAMA Medical News team.
Thank you for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Ann Cappola and me, Dr. Preeti Malani. This episode was produced by Shelley Steffens and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.